Eating disorders are among the deadliest mental health conditions we know of, and yet they're some of the least understood. Most people hear eating disorder and think of anorexia or bulimia, but the reality is there are many different types, and they're not just about food. They're about survival, control, trauma, and identity. Today, I want to take you past the stereotypes and into the reality of eating disorders, how they start, how they work in the brain, why they're so deeply ingrained, and why they can be so dangerous. Let's start with what an eating disorder is. Clinically, eating disorders are psychiatric illnesses characterized by severe disturbances in eating behaviors and in the thoughts surrounding food, weight, and body image. They are not choices. They are not diets gone too far. They're illnesses with biological, psychological, and social roots. And they are common. About 9% of the US population will experience an eating disorder in their lifetime. And here's a stat that shocks many people. Eating disorders have the second highest mortality rate of all psychiatric conditions, second only to opioid use disorder. Anorexia is defined by severe restriction of food, an intense fear of weight gain, and a distorted body image. The brain actually perceives the body differently. The parietal lobe and the insula show altered activity on imaging of these brains. People with anorexia can literally see themselves as larger than they are. It's egosyntonic, meaning the illness feels like part of the person's identity. That is what makes it very hard to treat because recovery can feel like losing yourself. Bulimia nervosa involves binge eating followed by compensatory behaviors such as vomiting, using laxative, using diuretics, or just extreme exercise. The cycle is brutal. Intense cravings and loss of control, followed by shame, panic, and punishment. The brain's dopamine reward pathway actually reinforces the binge, while serotonin dysregulation fuels the anxiety and obsession afterward. Many people with bulimia look healthy weight or even above average weight, which is one reason it's often missed. Now, binge eating disorder is the most common eating disorder in the US. People eat large amounts of food in a short period of time, feeling out of control, but without purging behaviors. It's linked to high rates of depression, trauma, and stigma. Here's something else important. It's not about being lazy or lacking willpower. Brain imaging shows reduced dopamine receptor availability, meaning the brain's reward system doesn't regulate properly in these individuals. Food can temporarily soothe, but the cycle of shame makes it worse. Eating disorders often start young. The average age of onset for anorexia is 12 to 13 years old. For bulimia and binge eating disorder, it's usually mid to late teens. Triggers vary, but trauma and bullying about weight, sports, or dance environments that emphasize thinness, or even something like an illness where appetite is suppressed, which can spiral into restriction. Genetics also matter, they play a part. There have been twin studies that show genetic rates up to 50 to 60%. They can be inherited, basically. And once the brain experiences restriction or binge, like purging cycles, it adapts. The metabolism slows, the hunger cues get dysregulated, and the neural pathways reinforce the behavior. It's not just stop. The brain has literally rewired to survive in the disordered pattern. That's why eating disorders are hard to treat. Eating disorders burrow deep in the brain and in the body. Personality traits like perfectionism, rigidity, or high anxiety often overlap with these disorders. Trauma makes food and body control a survival strategy. And then social factors like diet, culture, fat phobia, and praise for weight loss reward the disorder. And biologically, malnutrition itself changes the brain. Starvation lowers serotonin and dopamine. It shrinks our gray matter and causes cognitive rigidity. That's why someone with anorexia may double down on their behaviors even as they're collapsing physically. Recovery requires not just therapy, but medical stabilization, nutritional rehabilitation, and often family or community support. And even then, relapse rates are high. This part is blunt, but necessary. Eating disorders kill. Anorexia nervosa has a mortality rate of up to 10% from medical complications or suicide. Bulimia can cause electrolyte imbalances leading to sudden cardiac arrest. Binge eating disorder is linked to diabetes, hypertension, and increased mortality as well. Even people who look healthy can have dangerously abnormal lab work. The body pays a heavy price for our choices. Heart problems, kidney damage, osteoporosis, infertility, gastrointestinal rupture, brain fog, and the physiological toll, unrelenting shame, secrecy, and exhaustion, depression, anxiety, insomnia, no motivation, lack of focus. Because nutrition is so important for us. Good nutrition is so important for us, and it goes back to the gut biome we talked about. I mean, it plays a role in so many different aspects of our health. But there is hope even though recovery is difficult. Early intervention is key. The earlier treatment begins, the better the outcomes. Evidence-based treatments include family-based therapies, especially effective in adolescents, CBTE, which is enhanced cognitive behavioral therapy, which is the gold standard for many adults with eating disorders. There's also DBT, when emotional regulation is a core issue or personality disorder symptoms are at play. And then nutritional rehabilitation and trauma-informed care. Recovery doesn't mean life is suddenly perfect. It's not all sunshine and rainbows. It means freedom. Food becomes food again, not a battlefield. The person gets their life back and gets some peace, and with proper treatment, long-term recovery is possible. Even with the relapse rates, long-term recovery is possible. So if you or someone you know is struggling, please remember, it's not about vanity, it's not about a choice, and it's not hopeless. Eating disorders are serious, but with compassion, treatment, and persistence, people can and do recover. Okay, that's all for this topic. Eating disorders are a tough topic, and if you or someone you know is struggling, like I said, please reach out to a mental health professional or somebody that you trust and talk about it, because it is a vicious cycle and it doesn't end well unless you address it. And if you or someone you know is struggling, you can always text or call 988 24/7, 365 if you're in the US. And if you're outside of the US, you can look up a directory of suicide hotlines that you can call if you feel like you need to talk. And you can always go to your nearest emergency department. There are people that love you, and there are people that need you here. So it's important that you stay.